Attunement is a really big word in the counseling field. And I want to talk a little bit about what it actually is so that you have a deeper understanding of what it is that you're going for when you are facilitating your client's process. Now, sometimes attunement is confused with mirroring. So sometimes people think that if I'm attuning to someone, then in a sense, I look like them. So, for example, if my client is hyper aroused, if I'm attuned, then in some way I'm also going to look or be hyper aroused. Or if my client is a little bit more what we call dorsal or a little bit more shut down, then if I'm attuned, I'm also going to look like that. You may also think that attunement looks like copying. So, the client goes like this, and then you're going like this. And that's not exactly what attunement is. So, in order to understand attunement, we have to ask the question, what is it exactly that we're attuning to? And what we're attuning to is the resonant state that is happening in the moment as it's arising as a result of how the child is playing, how the child is telling the story. So, what that means is you're actually attuning to the felt sense in the room. So, let me give you an example here. So you may be with a child client that is incredibly hyper aroused. So they're in the session with you, they're hyper aroused, they are, let's even say that they're moving around the room a lot. Maybe they're even starting to dump things off the shelves, and there's a lot happening. And all of a sudden, you as a clinician start to feel sleepy and you start to feel tired and you start to feel like, wow, this is a lot. Now, an observer looking at the two of you might say, that clinician isn't attuned because that clinician looks a bit sleepy as the child is ramping up. But I said that attunement is to the resonance, it's to the felt sense. So that therapist is actually incredibly attuned, even though that clinician isn't necessarily mirroring what the child looks like. Because what the clinician is actually attuning to is the felt sense underneath all of the chaos, the felt sense of the exhaustion, the felt sense of it's too much, it's hard to track, the system just wants to shut down. So this is an important piece because sometimes attunement does look like, you do look like the individual, but sometimes you don't. So when we are attuning, remember, you're attuning to the felt sense in the room. And the last piece that I'll say about this is that I can't attune to the felt sense in the room unless I'm actually attuned to me first. So attunement starts here. What's going on in me? What's happening? What's arising in my physiology? And then we get curious about whether or not that's what's happening within our clients, which is different than what does my client look like? Oh, that must be now how I must feel. That's not how attunement works. So we take a breath. We allow ourselves to connect and to feel, to get connected with that resonant state, to become attuned with our own internal activation. And then we become curious about whether or not that is the same experience that's happening inside of the clients that we are working with.